Okay, great. So we have Dr. Alison Garza on the line. She's a family physician and a member of the Texas Emergency Medical Task Force. So right now, the COVID-19 obviously is a huge pandemic. We can call it that at this point, can we?
Absolutely, yes.
So,
classified by
I'm sorry, go ahead.
It's been classified as a pandemic by both the World Health Organization and the CDC.
Okay, so what exactly are you looking for when people come in with either flu-like symptoms or something like that?
So the number one thing we're looking for is any recent travel history, and I don't mean to China and Iran and South Korea. We really don't even include that anymore. It's travel history in the United States now because we know there's community spread. Some patients have international travel and have come to our office, drive-through clinic with a history of 2 weeks ago came back from Milan, 3 weeks ago came back from Japan and Taiwan, had a truck driver come through that spent 2 weeks in Washington State. If they have traveled to any of the affected countries, or if there's been any travel at all, or high-risk people like healthcare workers, we are testing them. There's community spread in the nation, and we need to be able to test them.
So when you talk about community, explain exactly what that is.
Community?
Yes, the word community as it pertains to the virus.
Okay, so the virus has shown itself to spread into clusters in communities. So one patient infects two patients. Those two patients infect 6 patients. Those 6 infect 12, and on and on. So you get these little community clusters. If you look at some of those maps of the nation of where these community clusters are, they tend to follow wherever there was a positive person. There will be a community of clusters. So it's within a community. Let's say within, I'm going to say, the New York community in Westchester County. They had a community cluster. So it's people that went about their daily business for a couple of days, not realizing they were being exposed to the coronavirus from a coronavirus positive person. And now those communities have heavy loads of coronavirus positive patients.
Okay, I get you now. Okay, so what precautions should we be taking here in the Rio Grande Valley if we've learned anything from New York, from California, from Spain, from any other place?
Without a doubt, we need people to stay home. If you're sick, do not go to work, do not go out. Even if you're not sick, we need to decrease the amount of time and the number of places people are going publicly. We know this is spread by respiratory droplet transmission. Initially, it was also spread by airborne transmission. But last Wednesday night, after President Trump's speech on TV, the CDC announced that it was only considered respiratory droplet transmission now and not airborne. So therefore, we in the healthcare communities didn't have to worry so much about wearing that special N95 mask.
Right.
Now, everybody that I'm in contact with in medical circles, both locally and in the nation, has said basically BS to that. Because if you look on the CDC website under healthcare providers, and you click on the links for interim care for caring for a patient that was positively exposed to a coronavirus patient, or interim care for somebody that's a PUI, a person under investigation. If you feel you're going to swab them, they become a PUI. If you look there, the actual statement is, once our medical supply is returned to normal levels for the masks, they want us all back in N95 masks. So I think they just dropped it from airborne to respiratory to sort of calm the fears of people that didn't have the N95 mask in healthcare. But in reality, none of us in healthcare are wearing surgical masks. It's all the way N95.
Interesting. Do you think that we should be panicking here in the Rio Grande Valley, or what should we be doing as precautions?
I don't think we should be panicking at all, but I think everyone should do their part to stay home as much as possible. Do not have your friends over for a game night or a barbecue. Do not let your kids go on a play date with another family's child. Do not go to the movies. Don't go to the restaurants. Don't go to the bars. Cook inside your house. Play board games. Stay inside as much as possible. Right now, as far as we know, we have little or no transmission here in the Rio Grande Valley as far as positive confirmed cases. I've got about 23 cases that I have tested, and I've only received results for 5. I was one of the first to start testing here on Thursday morning in the Rio Grande Valley, and so we really don't know how much of it is in our community right now, because we're a community of a lot of travelers.
Right.
The Rio Grande Valley has a lot of travelers. Most recently, what I'm seeing is a lot of people that just came back from Las Vegas recently. I had a couple this morning that just came back from New Orleans. Well, New Orleans had 6 or 7 positive cases this weekend, and they shut down Bourbon Street. So we need to protect ourselves, our community, by not spreading it in our community. We don't want it in our community. So we want you to stay home. There's a hashtag trending called Flatten the Curve. This is coming from physicians, virologists, immunologists, and epidemiologists all over the nation that are saying, stay home. We've been saying this for 10 days now. Stay home. Wash your hands. Do not go out in public. We're trying to flatten the curve so that our healthcare system does not get overwhelmed by the exponentially greater cases that are happening every day, not only in Italy and in Spain and France, but here in the U.S. We're following an exponential rise as well. So we want everybody to stay home. And I'm not meaning never go out of your house. You can go out, you can walk, you can jog, you can run, you can go in your yard, but we don't want you interacting with people. We don't want you in large groups, as of last night, more than 10 people. If you can avoid that at all, that's even better. If your group size is less than 10 and it's just 2 people, even better. We have to encourage aggressive hand hygiene, washing your hands with soap and water every time you come in and out of your house, taking your clothes off if you've gone somewhere public when you come in the house, and immediately putting them in the washing machine. We know the COVID-19 virus is susceptible to laundering, that it does get rid of it. Cough etiquette, respiratory etiquette. For a while, for flu, we say cough into your elbow. Well, we're not recommending that with coronavirus right now, because you cough into your elbow and all the respiratory particles are all over your clothes and your elbow. And then, as you know, in the Valley, we like to do the Valley hug and kiss.
Right.
And so anybody that touches your arm or you put your arm around them, you've just potentially contaminated that person with coronavirus. Then they touch their hand to their arm or their shoulder, and they touch their mouth, and here we go. So a lot of aggressive just hygiene precautions, hand hygiene precautions, especially respiratory precautions, which are those cough and sneeze precautions. We'd rather have you cough and sneeze in a tissue and then dispose of the tissue in a closed garbage bag.
Got you. Okay.
Then do the cough.
When you talk about your testing for the coronavirus, what does that look like, the difference between that and then the regular flu?
And the regular flu, clinically, what does it look like?
Yeah, like what exactly are you doing during the tests to test people for coronavirus?
Okay, so the actual testing process is almost identical, but the testing supplies are different. So the flu is a rapid test, and we have a small cassette. There's a nasal swab in there. We stick the nasal swab way up your nose, swirl it around a bunch, spread it on the cassette, add some developing fluid specifically for flu, and the test starts counting down for 15 minutes and gives us a positive or a negative. The coronavirus testing is much more intensive in terms of preparation and supplies. So the swab kit is a 3 millimeter tube that's filled with a special reagent. It's kind of light peach or pink colored. The swab itself is almost identical to the swab for flu. It's what we call a flocked tip nasal swab. And we put that swab way up your nose as far as we can in the back and swirl it around 3 or 4 times, immediately put it into the culture tube, snap the end of the stick off, and cap it. It needs to be frozen immediately upon collection. That's different from our flu tests, which sit on a table and develop in a cassette. We don't have to freeze those. After frozen, after frozen procedures have taken place, it can then be transferred by Quest. We're using Quest to their lab, and they complete the testing for us. So the swabs are completely different in terms of the testing supplies, but the collection technique is very similar. It's the same sort of approach with a swab up your nose, trying to get as deep as we can, but the supplies are different and the actual testing is different.
Understood. And how long does it take to get these results back?
I sent my first test Thursday at 5 p.m. and I received them Sunday morning at 8 a.m. So we're looking about 2.5 days. So that's a pretty good turnaround time.
Yeah, definitely.
The lab,
So
some labs are quoting 3, 4, 5 days. It's, it'll probably slow down once more people start testing, but unfortunately, nobody has had the ability to test until Thursday morning for doctors in the private sector. The public sector, our local health department, our state health department, our state lab in Harlingen have had zero tests, and they've tested 0 people as of Friday at 1 p.m. when I talked to our county health department people in my office. They were very curious since I put on Facebook we were able to test on Thursday. They wanted to know all about it, what kind of test it was, and was I doing the correct test and all kinds of things. It's just, I got to tell you, I was very offended, okay?
interesting.
I'm a board-certified physician. I've been practicing for 30 years. I'm not going to advertise that I have some wackadoodle fake test, okay?
Exactly.
The public health department is under the CDC with the state. They have proven to be completely ineffective in distributing tests or testing people. In fact, the public health department uses the old CDC guidelines and haven't tested anybody. Even if they wanted to test, they couldn't have tested because they didn't have a test swab. So there's a big disconnect between the government and the private sector of medical care. So in the private sector, we've been able to start testing, start drive-through clinics, start taking care of our patient population that needs to be tested. The public sector, good luck with that.
Interesting.
Good luck with that.
So in your professional opinion, do you believe that there are cases here that we just can't find or we haven't tested for already?
Absolutely. Absolutely. I'm on a chat room with 80,000 female physicians across the nation. We've been on for years and years and years. And usually we talk about other topics or, I had this case today, what do y'all think, whatever. Well, we have a COVID-19 subgroup, and we have been absolutely wringing our hands for 6 weeks about the lack of testing, about the information that's being passed that is not correct. And I took it upon myself last week to start posting long posts on my Family First Medical Center Facebook page to explain exactly what is going on. I think one of the biggest confusions right now is everyone thinks coronavirus testing is free. And it is so far from being free, it's probably going to be the summer before it's free.
Wow.
So we know that House of Representatives passed the bill late Friday night, early Saturday morning, that they approved the bill for free corona testing, among other things. The Senate had already convened for the weekend and were not available to vote on it. So they were supposed to get together yesterday. A lot of senators said, we haven't even read the 100-page bill. We're not going to vote on it till we read it. So the Senate is supposed to vote on it. And I apologize, they may have voted on it yesterday. I have not had any time to even look at the news since probably Saturday. The Senate is supposed to pass it. We expect them to pass it, at which point it goes to the president for signature. We expect the president to sign it. After that, it does not mean there's free corona testing. This free corona testing is coming from our government, which means they're going to have to release the monies and the supplies and distribute them to all of these state labs and local health departments, which so far have not been able to test. And once that happens, which is going to take weeks, you can imagine, if it's taken 6 weeks for them to even talk about this, you can imagine how long it's going to take for the monies to be released and the supplies to be distributed to the personnel in the health departments and the state labs. One of the things the president said that is very concerning to us female physicians across the nation is that Walmart, Target, CVS, whoever is going to be doing drive-through testing. We're all wondering exactly who is going to be doing that testing, because the Walmart employees aren't trained for personal protective equipment donning, taking it on and off. They're not trained to do nasal swabs. So who's going to be actually utilizing the so-called tests that are going to be available from the government to do these drive-through tests? Are the Walmart employees or the Target employees going to be doing this? This is something that there's a lot of holes in what the government is saying. So our expectation is probably more than 4 weeks before this can even be implemented in the United States, because we don't know what workforce they're going to put there in personal protective equipment, which is short. We know, and I'm telling you, my 80,000 female physicians across the nation, more than 75% of them say, I can't test because I don't have PPE. I'm out of PPE. I don't have gowns. I don't have masks. I don't have goggles. So most of the nation is crippled in the private sector also because we don't have enough personal protective equipment, PPE. So I really want to push that home that, the government test that is coming, yes, it's going to be free. The private labs that have rolled their tests out as of last week, that's Quest, LabCorp, Mayo Clinic, I've heard of a couple of others, those aren't free tests. And I spoke to somebody from Quest yesterday and I said, okay, when this does become law, is this going to be a free test? He said, absolutely not. We're a private lab. He said the government can do their free testing, but we've been given the green light since, 10 days ago to develop our own tests. And he said, ours aren't free. It's the private lab, your private practice, it's private patients with private insurance. So, I really took a social beating on my office Facebook page the first day I posted that we had tests. I had patients accusing me of being a fraud, a liar, people saying I should lose my license. They were going to report me. The county health department actually posted a nasty remark on my Facebook page. It's been hideous. But you know what? I don't care. I'm here to do a job for my patients, and I'm going to do what's right. I got the test. I'm running the test, and I'm getting results. So I don't care what they did to me on social media.
I completely commend you for that. What would it cost right now if somebody were to go into your clinic right now and want to get a test for the coronavirus?
So the test itself, we're not collecting money at all. We send it to Quest Lab with their insurance information, and Quest Lab is going to bill their insurance.
Okay.
We don't collect for the test at all. Now, if you come to my clinic, we can't just test everyone. We have to make sure, one of the things that the expanded CDC guidelines says is that physicians at their discretion can test patients that don't meet the strict guidelines. So for that, they're telling us to rule out other reasons why the patient might have a fever and cough, which right now is flu because it's flu season still. Mm-hmm. So we have to, at the very least, rule out flu, which means an office visit because we're evaluating you, we're taking your vital signs, we're doing, a swab on you, a nasal flu swab on you, and then the physician is making the determination of whether you should get a COVID-19 swab. So we charge an office visit, which for most people is going to be an office copay. But we are not charging for the coronavirus testing. We circle it, and it's called a send-out lab, and it goes to Quest. They will be billing the patient's insurance. Now, one of the possibilities that we're thinking may come down the pipe is that after the actual coronavirus testing bill goes into law for free testing, maybe the insurance companies will actually cover the cost. I got an email yesterday from Blue Cross Blue Shield, which said they are covering the cost.
Okay.
Which means lab bills it to the patient, so to speak. That Blue Cross, when the lab bills it to Blue Cross to say we did this test, that Blue Cross is going to cover the cost and the patient won't have a balance. I honestly don't know about the other insurances. None of them have given me any updates yet. Blue Cross Blue Shield is our number one provider in our area. About 70% or so of insured people here are Blue Cross Blue Shield. So it's nice that we know they are going to cover the test.
Right.
And then there's also another, unfortunately, another distinction. So coverage by an insurance company does not mean it's free. It means they pay for part of something. They may pay for all, but coverage, like if you call your insurance company, do I have coverage for the coronavirus test? And they tell you yes. Okay, you think it's free, but you may end up with a bill because the insurance only will pay the lab, say, $29, and so you have a $14 balance or something. So we have to be careful about the semantics in medicine and especially in the insurance industry. Very complicated.
Yeah, it's a very interesting thing. As of right now, we do not have a treatment for this, right?
Correct. There is no treatment and there is no vaccine.
Interesting. Okay.
The vaccine ended trial 1 yesterday, I believe, and they started administering it to some humans. That will go on for another 3 to 6 months to record any side effects, any untoward complications. They have to assimilate their data after that, and then it goes into phase 3. So realistically, we're still looking at close to a year before we're going to have a vaccine for this.
Okay.
Yep.
Interesting. So when we talk about the word novel virus, what exactly does that mean?
So novel virus means new. This virus is new to the human race. We have never, ever, ever had it in the history of humans or been transmittable to us in the human race. So it's new to our bodies. Our bodies have no idea what it is. Our immune system does not have antibodies to fight it back or knock it down. It's new to us. It's novel to us. So that's the reason why it's so worrisome, because we do not have a way internally to fight it. You know, if you get exposed to a cold virus, you've been exposed before and your body says, oh, we remember this and we're not going to let it, overwhelm you. We're going to send out antibodies and take care of this. With a novel virus, your body has never seen it before, and before the body can even react and send out what it needs to send out, it's overwhelmed your body, your lung cells, and you're going down the dark hole. So it's novel because it's new.
Interesting. Okay. Doctor, I appreciate your time. At this time, you can lead people to your Facebook page so they can get more information, but is there any other insight that you can give us that nobody's really talking about yet?
So there's been a rumor for 2 or 3 days that we're actually going to go into more of a lockdown soon nationally. I've seen it on the chat page I'm on with the 80,000 female physicians across the nation. There's women there that are in the upper echelons of the U.S. government and medical care in Washington, D.C. CDC have some people had a female report to me this morning that we will be going on lockdown soon. That rumor has been circling for I woke up to it on Sunday morning and saw it. So we're about at the 3-day mark for that. But I assume at some point we will get there, especially if we can't control our numbers. So everyone just needs to be prepared. Make sure you have a full tank of gas, just like hurricane preparedness. Make sure you have a full tank of gas. Make sure you have some cash in the house. Make sure you have enough food and water and pet supplies and medications so that you can stay in the house and not have to go out and get any of this stuff.
All right, doctor, I'm sorry, go ahead.
Simple preparation. That's it.
All right, Dr. Alison Garza, I appreciate your time. And once again, can you plug your Facebook page so everybody can get some more information?
Yes, it's Family First Medical Center, Dr. Alison Garza, and we are on Facebook. We had a Facebook Live video yesterday with the City of Edinburgh that you can see on the City of Edinburgh's Facebook page as well. But I've posted 3 or 4 very, very long updates since last week about everything I know. I'm trying to keep everyone up to date so we can educate our community and make sure that we keep this out of our community, or at least if it's here, we keep it contained.
Great, Doctor. I appreciate your time.
All right. Great talking to you. Call me again if you need me.
Definitely. Thank you.